Your neck's just tight. You know that.
I know.
I'm anti-milk for sure.
Yeah, are you?
Yeah, milk is gross. Almond milk is where it's at. You can get even the almond
Yeah.
milk creamer now.
Really?
It's a little more expensive, the creamer, but it's bomb.
Joe gave me some neck exercises.
Good.
I've been trying to do that. That's helped.
Exactly, yeah.
I got more flexibility.
So Little Dominic came in 4 years old. History of not being able to breathe, snorting due to swollen adenoids, and I believe tonsils as well, but congestive head, neck, infection. His mom actually was praying to find somebody who could help him avoid surgery. She had just spoke to and had surgery scheduled, was basically being told by head, ears, nose, throat doctors and everybody that that was his only option. I actually recorded video of him sleeping and not being able to breathe while he slept. And if you can imagine, that would be pretty scary for your kiddo to worry if their throat's gonna close up. And that was the norm for her for the last 4 years. That's just who Dominic was. She got the word about this place from some random person. She brought him in right before he was supposed to have surgery. I believe it was a few days after that first adjustment. She also recorded some more video of him sleeping. But you could tell there was a marked change in the way he was breathing from what had been the norm for the last 4 years. There was improvement now. And the backstory on him is unvaccinated kid, no antibiotics. Mom really wanted to do it natural with Dominic. She was talking to me on the phone, scared to death about her son because he had a 105 fever, it was spiking, and she was really worried that something seriously bad was happening. I talked her through it. She was very scared, but when you open up that congestion, the head sometimes can drain some of that nasty bacteria and stuff that's been congested up there. She trusted me through that, and I think it was a few days later, it kind of cooled off. He was breathing and it was basically normal. Within 2 weeks, he went from swollen, infected adenoids that needed to be removed to now breathing normally, and surgery is not really an option or necessary for him anymore. His life has changed. I imagine he would be a totally different person as an adult if that was the path he would have went down, having surgery and antibiotics and doing that whole thing as a 4-year-old versus who he's going to be as a young man and the kind of health he's going to get to experience as a result of doing something as simple as realigning his atlas. Now for you specifically, when that's off, it's going to put a lot of pressure on each of these nerve roots coming out. You're going to have the head, brain's in there encased. You're going to have the brain stem popping through here, and the main electrical lines going down through the spine. At each level, you're going to go boom, 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 boom. Let the head just be heavy. There you go. Leg check looks good today.
Yay.
How have you been feeling overall? Feeling better? Feeling
My lower back's getting less and less pain.
cool. Because you're taking pressure off of basically the lower brain with the adjustment.
Right.
So all of a sudden you're going to have more normal function. It'll continue to improve as long as you're in alignment. But when it goes back out, your body will revert into that pattern and start building up damage again. It's not adjusting you that gets you better. It's you staying in alignment over time. Yeah,
Just irritated or all?
you're out, homie.
I just drove in from vacation. Like I have to go to Dr. Collins.
That's what was hurting the other day, but it was worse than just that.
All right, welcome to the Ask Dr. Collins show. If you guys have any questions for Instagram Live, start sending them in now. You'll also see this on Facebook, but I want this to be an open platform where people can ask questions about their health, wellness, like diet, fitness, stuff like that. But really the kind of work I do is centered around the spine and the top bones in the neck, the upper cervical spine.
Okay, so the first question is going to be from @Medicine with Caitlin. And she wanted to know, did you always know that you wanted to be a doctor, and when did you determine your specialty?
I thought I wanted to be a plastic surgeon in college until I ended up having really bad back pain, and the only person who could help me with that was a chiropractor. And from there I started doing research and trying to find what the best, most effective forms of chiropractic were, and that led me to the upper cervical spine. And then from there, over the next few years, I was looking for the best upper cervical spine guys, and that's the kind of work I do, which is called advanced orthogonal. So. What's the main difference you notice in your body from when you were out versus now?
Okay, it's better. It's like where that was like a 12, you know.
Yeah, what's it at
This
now?
is like about between a 6 and a 7,
Okay,
and sometimes a little bit less, sometimes a little bit more.
but it's heading down.
Yes. Oh yeah. No, I'm so grateful.
Right on.
Because there was no way that I could do that on my own. There was just no way.
Isn't it wild how pain will make you non-functional?
Oh.
It's wild. I don't fully realize it until I'm in pain,
Uh-huh.
you know? But you're basically useless.
Oh, definitely.
You turn into like a little baby.